All right. So this is what we call the triple win framework. And the way that I like to introduce it is using a very familiar analogy to those of us in healthcare, which is the triple aim in medicine. And so the triple aim is you want to improve the health of populations while at the same time reducing the cost of healthcare, and also at the same time improving the experience of care. So making care more timely, convenient, equitable, patient-centered, et cetera. And then we expand this to what we call the triple win. And so for your idea to get traction, generally you want to articulate how it creates a triple win for multiple stakeholder groups. And so in most cases at CHOP, these will include patients, clinicians, or researchers, and CHOP, or the institution or the organization. So obviously your idea has to create value for patients. And so some ways of doing that are, does it improve outcomes? Does it improve experience? Or does it improve access? Or some other dimension of what the patient needs. However, your idea can't simply improve the patient's life. If it makes clinicians' lives a lot worse, then you'll never get traction or buy-in for this to move forward. And so can the idea at the same time extend the expertise of our very small group of clinicians to other regions throughout this, throughout the state, throughout the country, throughout the globe? Can it make their work more efficient and reduce burnout? And can it lead to advancement opportunities? So new opportunities for discovering new diagnostics, new therapeutics, new ways of taking care of patients. And then finally at the bottom, we put CHOP here. We'll get into this a bit more detail. This could be whoever needs to fund or support the idea. So it could be CHOP, it could be an investor, it could be the NIH or another funding agency. But you need to also articulate, how does this idea create value for the party that you're seeking resources from? And so the example here for CHOP is, can this idea lead to growth? Can it lead to reduction in costs? Can it help expand our reputation and attract more talent? And thanks, but yeah, it could be an insurance company, a payer as well. And so if your idea can really fit at the intersection of all three, then we call that a triple win. And so this is a very, I think, simple and elegant framework for taking any idea and expanding upon how this creates value for the most important stakeholders. I've seen versions of this out there as well. So I can't claim exclusivity or that I invented this, but I think I've found that this works really, really well among different audiences here at CHOP. So if we go to the next slide, we can expand upon this a little bit. I won't read through all of these, but these are some example questions that you can ask yourself to help unpack some of these areas. And so, for example, with patients, articulating what is the unmet need? What is the gap right now in the current treatments or care pathways or resources that patients need to either access care or achieve some sort of outcomes improvement? How many patients does this idea reach? What's the impact of this idea? Is it a true breakthrough or an incremental improvement? And both are fine. I think it's important though to distinguish the difference between them. And then if we don't move forward with this idea, what's the current state of care and what are future alternatives? So again, just some quick examples of questions you can ask yourself to unpack this. And I'll close up my remarks just by applying this to a specific example that is happening right now at CHOP. So as Susie had mentioned, I also lead digital health innovation here. And so one of the ideas we came up with was leveraging remote patient management as a way to care for our chronically ill patients outside of the hospital. And here on the right, you can see, how this creates a triple win for patients, clinicians, and CHOP. So for patients, again, these are, very complex patients, sometimes, frontier program patients. And so this is a way for us to help improve clinical outcomes through more frequent monitoring and check-ins with the care team. And it also provides a great experience. They can remain connected without having to be in the hospital. For clinicians, this could be a much more efficient workflow. This can replace phone calls and paper diaries with symptoms with an automated solution that they can check and monitor like a dashboard. And it also provides a lot more data that can feed into research and new discoveries. And then finally, for CHOP, we think that RPM, or patient management, can help grow Frontier and other programs because we can discharge patients to home, and home could be 10 states away. They can still be monitored by this program. So I think it'll attract national growth and also improve capacity. We can discharge patients earlier and free up a bed for the next patient. And then finally, this can generate direct reimbursement. And so there's that financial component in return to CHOP as well. So I'll pause there. This is, one example of how to apply this framework to get support for an idea. And I'll ask Brendan to maybe chime in with other examples from his work, and then also go into how this can then move into the business planning phase.
Yeah, thanks, Linda, so much. Before I continue to Linda's point, does anyone have any questions, comments at this juncture? Great. So I want to be cognizant we have 3 minutes until we're supposed to move on to the exercise itself, so I'll go quick. One other case example, and it's not necessarily something I'm working on at the moment, but could fit really nicely into this type of framework, is something like developing an AI tool for autism diagnosis. So if we were able to come up with a tool that could actually be accepted by counties and school districts to qualify patients for enhanced resources or individual learning plans, that could be something truly innovative and really fit, I think, nicely within this triple win framework. So from a patient perspective, it would increase access to patients and families that right now are really experiencing a really long backlog to get in to see the limited amount of specialists that we have in developmental pediatrics. It would be a win for clinicians. It would allow our limited experts in developmental peds to really focus on the most complex autism cases. And it could be a win for CHOP because if a CHOP physician or researcher were able to come up with something that met the standards of school districts, it would bring brand recognition, awareness to CHOP, and it could be maybe a technology platform that could be leveraged for other divisions that are experiencing similar mismatches between supply and demand. So, Vicki, if we go on the next slide, understanding I only have a couple minutes left, I see Remo said, great idea. He's been working towards some tools to assist. That's fantastic. So we're now getting away from the framework a little bit and just scratching the surface of a little bit more of the tactics around business planning. Just a little bit of a PSA. So in my role, I co-chaired the BOAT committee at CHOP. BOAT stands for Business Opportunity Assessment Team, along with my co-chair in finance, Megan Lutz. So if anyone has any questions after this discussion around what's the proper forum to get my business plan vetted and approved, please don't hesitate to email myself or Megan for any sort of guidance. And I believe on the next slide, there's a link that also provides more detail on proper forums and resources for business planning. I was going to talk a little bit more about the previous slide, but we are at 12:20, and I really want to make sure that everyone has ample time to go do the exercises and come back and discuss with the group. So, Vicky, you can move to the next slide. So, we now have the next 20 minutes of our time together. We'll be breaking you all out into respective teams. I will defer to Vicky to determine which team's going to assign to which topic. But a couple teams will be assigned to develop a triple win story, if you will, for a CHOP-owned post-acute facility. And the slides that you will get will provide a little bit more detail in the form of a fact pattern for what exactly that means. The other group will be assigned cell and gene therapy, and then the other digital second opinion. So you'll have 20 minutes to discuss amongst yourselves and begin to fill in the triple win framework. Having said that, I'm going to go a little off script here. If any of you have an idea that you're just dying to put to this framework, definitely feel free to not pursue one of these three and apply one of your own ideas to the framework. So we don't need to be overly rigid here. And then at the end of 20 minutes, I think Vicky will work her magical powers and bring everyone back into the room together. And we're going to ask a few teams to volunteer to read out their work, and then reserve a couple minutes at the end to have just a broader group discussion around what are the key themes and learnings from the exercise that you experienced. And it should be a lot of fun. So with that, I will turn it over to, I believe, maybe Vicky to give a little bit more instruction.
Yeah, oh, sorry, there's a little bit of echo. I'm going to open the rooms for everyone to just basically go into in a second. I'm also going to send into each chat a link to an actual PowerPoint document where you'll be able to fill in. So just give me a minute after you go into your rooms, and then you'll have the actual cases. Yeah, Linda?
Just really quick guidance on this exercise. So I found that, among the three categories, the funder needs is typically the most difficult. I think based on your roles, I think you'll have no problem articulating the patient needs and the clinician needs, but I would encourage you to try and work through that a bit more quickly and spend more time on the funder needs. That's the most challenging, and it's also the most important in getting support for your ideas. So putting yourself in the shoes of those who are carrying, holding the purse strings, I think is going to be the most important exercise. So just for your time management during the 20 minutes, try to spend the most time on that third category.